Hi, it's Lee Brandon here, injury rehab specialist. Now, how would you feel if you woke up every day and your lower back felt amazing and you could do whatever you wanted to do without any restriction or limitations? Well, in today's video, I'm going to talk about sciatica pain or sciatic pain. So what is sciatic pain? Well, generally it's a pain that goes through the gluteal region all the way down the leg, and it can go all the way down to the feet and the toes. Some people might just have it in the gluteal region. It could go any distance down the leg, and it could go down one leg, it could go down both legs. And I'll talk a bit more about that in a moment. So what can cause sciatic pain? Well, there are three main causes of sciatic pain. First of all, it can be due to a lumbar disc bulge, which entraps the nerves in the lower back, which then go down into the body and become the sciatic nerve. It can also be caused by what's called a spinal stenosis. So stenosis generally means narrowing. So there's normally a bony growth either in the spinal canal or in what's called a transverse foramen. And also there's something called a piriformis syndrome. So if you're wondering what is causing your sciatic pain, then there's a few things you can look at to try and work out what potentially that could be, because it's really important in order to heal that you actually understand A, what condition you've got, but B, what's causing that condition. Now, the next thing I would say is if you do have sciatic symptoms, I would suggest that you go and see an appropriate professional to help you with that. I wouldn't necessarily suggest that you try and deal with this on your own. However, I'm going to give you a few hints and tips today. So the first potential cause of sciatic pain, as I mentioned, is a disc bulge. Now, the ways that you can normally identify from your symptoms a disc bulge are the following. So you're generally going to have pain in the lower back itself. You'll often have symptoms worse first thing in the morning, because overnight your lumbar discs, they fill up with water, so they expand, and there's more chance they're going to be irritating on a nerve. You'll generally get sciatic symptoms only down one leg or the other. Most disc bulges are what's called a posterior lateral disc bulge, so it'll either be to the left or to the right. Oftentimes things like coughing, sneezing, going to the toilet can feel a bit uncomfortable. Also, you might have weakness and numbness in the leg. Oftentimes a disc bulge might be preceded by heavy weight training in the gym. And oftentimes people that perform a lot of flexion, so flexing forwards and rotation, tend to have a bigger incidence of disc injury. So for instance, people that row, people that cycle, they're in a flexed position quite a lot. And then if we look at people like cricketers, tennis players, they've got flexion and rotation, which is relatively stressful on the discs. So there's some of the key pointers to look out for a disc bulge. Now, a spinal stenosis, one thing I just wanted to make really clear with the disc bulge, when you bend forwards, that will tend to make your symptoms worse as well. So things like doing up your shoelaces, putting socks on, things like that can be either extremely painful or just completely impossible due to the pain. So next thing, spinal stenosis. Now with the spinal stenosis, you'll tend to feel relief bending forwards. So you'll actually reduce your symptoms, because when you bend forwards, what it does, it actually increases the size of the foramen, or the area in which the nerves and nerve roots go through, and actually creates more space, takes pressure off of the nerves. Now, if you were to extend backwards, that would tend to make your symptoms worse. So that's a rough idea of what might be a disc injury or what might be a stenosis. The other thing with stenosis, it tends to happen more so in older people, but again, you can be any age. The other thing as well with the stenosis, oftentimes it's actually both legs that you're going to feel sciatic symptoms, whereas with a disc injury, most of the time it will tend to be one leg, not both. Now, if you've got sciatic symptoms but you don't have any back pain, the chances are you've then got what's called a piriformis syndrome. So the piriformis muscle is in the gluteal region, it's deep to the gluteal muscles. It crosses the sacroiliac joint and it helps to stabilize the sacroiliac joint. And quite often this muscle tightens to compensate for weak lower abdominals, deep abdominal muscles, and also for what's called the posterior oblique system, which is a force coupling between the latissimus dorsi and the gluteus maximus muscle. So you need to be careful with piriformis syndrome, just stretching the piriformis muscle, whilst it might take some of the relief off of the nerve, actually might further destabilize the sacroiliac joint and create more or different problems. So it's really important that you work with a skilled therapist, conditioning coach to help you get over that. So I will show you videos on exercises, stretches, etc. you can do to help with each of those conditions in a future video. So to make sure you see that video, please subscribe to the BodyCheck YouTube channel and please like the BodyCheck Facebook page, and I look forward to seeing you soon in another video. Bye for now.